Good morning, it's Dr. Garrett and I'm here at Empowering Health, and today I wanted to talk to you about supplementation with vitamin D. Now, vitamin D is one of those very important vitamins within our body. It's more than just bone health. It helps regulate so many functions, including our hormones, including our endocrine functions. It will help with anxiety, depression, and it is very, very important for our bodies to get this. Unfortunately, in Indiana, because we don't get a whole lot of sunshine during the winter months, most people tend to drop very low on their vitamin D, and then they have a lot of side effects. So let's talk about how to supplement. Now, vitamin D is a fat-soluble vitamin, so with that comes two issues. One, you can get too much of it and it can be stored up within the fat. So it's very important that we know what your levels are. That way we can guide you in how much to take and when to take it. The other problem that can come along with that is that you need to take this with a meal. Because it is a fat-soluble vitamin, it needs fat to be assimilated or to be absorbed within the body. So taking your vitamin D at night or taking it in the morning on an empty stomach is not doing you any good whatsoever. So with the vitamin D3, what do we recommend? D3 is the more bioavailable kind that will be utilized by the body better. So we recommend that you're taking this with food. But how much do you take? Now, normal range, again, 30 to 100, middle of the road is 65, optimized is 65 to 80. So what we're typically recommending is if you are low, less than like 40, we're recommending a vitamin D3 of at least 10,000 international units a day with a meal. If you're sitting more like 45 to 60, we'll recommend just 5,000 international units a day with a meal. So there are some other things that can come along with this. Now, vitamin D has a BFF of calcium, meaning wherever vitamin D goes, calcium wants to follow along. So we worry about vitamin D laying down calcium within the arteries of the walls of the arteries, or within the kidneys and creating kidney stones. So how do we prevent that or circumvent that? It's very easy. I'm recommending that your vitamin D supplement have a K2 in it as well. This is going to help prevent or circumvent that calcium from laying down in the walls of the artery or in the renal pelvis, causing kidney stones or calcification within the arteries. So now I've completely confused you, and you're going, I don't even know what to take. So we do have supplements here at the office. We do have the 80K10s and the 80K5s. But if you're going to a pharmacy, we're recommending that you go to a good pharmacy. Harrison Pharmacy is really, really good, and they have some great supplements over there. Or we recommend that you do something like Standard Process or Designs for Health if you're not going to be doing the medical grade Bioti vitamins. We recommend that you're taking a vitamin D3 supplement with K2 of at least 10,000 international units if you're very low, or 5,000 international units if you're on the higher end of the spectrum. Now, if you're not good about taking supplements, we do offer injections of 50,000 international units of vitamin D3, and we recommend those once a week. It does take a while for your body to build these levels back up. So it's nothing that if you take it for 5 days, you're going to feel better. Typically, we're looking more at 6 weeks. We're usually drawing people's blood about 4 to 6 weeks, and then we're seeing a pretty moderate rise, usually about 10 to 15 points if you're taking the 10,000 international units every single day with a meal. Now, again, if you're curious as to what your lab levels are, give us a call. We can get a quick blood draw and let you know and help guide you along the path so that you can live a healthier, happier life.